This video is going to finish up chapter 28, the reproduction chapter. We're starting on what is in my notes on page 5 with gastrulation. We've kind of already hit on this topic before because we talked about what a gastrula was. So gastrulation is the process that makes a gastrula. This is how our cells start to enfold to make that primitive gut, and then the cells differentiate to start to make our primary germ layers. Now, a little bit after gastrulation, the embryo does some contortions and it starts to end up looking sort of vaguely like a corn kernel, like in this picture going on right off over here. What you end up with is this groove that is going to end up starting to make our bilateral symmetry obvious. So we start to get sort of there's going to be a definitive head region, there's going to be a definitive tail region, and so the primitive streak is what starts to set up that axis where we start to end up with that head region and that tail region. The notochord is going to end up becoming the discs that are in between the vertebrae. Remember that fibrocartilage that we talked about in previous chapters? So the notochord is a feature that all the chordates have. So all the vertebrate animals have a notochord, but in us it ends up becoming essentially the spinal cord. Well, I shouldn't say spinal cord. I should say the vertebrae and the intervertebral discs. The spinal cord comes from a different tissue. Organogenesis is exactly what you think of. It's the creation of organs. So this starts to happen very early in an embryo. In some cases, the organs actually start to form before the mom even knows that she's pregnant. And what's problematic about that is if mom is not living right, like she's drinking a lot, or she's smoking, or she has a crappy diet, that can impact how the organs end up forming during organogenesis. The neural tube is exactly what it sounds like, essentially. As we start to make that corn kernel thing, we end up with that streak. Well, that primitive neural tube is supposed to end up closing up to make a sealed tube. The neural tube is created, like it says up here, by the ectoderm, and if that tube does not seal up completely, that's how you end up with that spina bifida that we had talked about a little bit last semester. It's because the tube doesn't seal correctly. Last semester we also mentioned folate is one of the B vitamins. If a mom doesn't get enough of this, the neural tube is less likely to seal up, and that increases the risk of spina bifida ending up developing. The reason why this one is problematic goes back to what I was saying a second ago. This starts to happen in a lot of cases before mom even realizes that she's pregnant, and so if she's not eating very well, it can end up creating grave nervous system abnormalities in the child, all because this starts to form very early in the pregnancy. Primitive gut is exactly what it sounds like. You can't even really tell what a lot of these organs are in here, and yet it is going to be what turns into our GI tract, our alimentary canal. When you start to look at a nice sealed up embryo that is, again, very early in development, we're about 3 to 4 weeks in this picture, you get these little body segments going on right here. Those body segments are somites, and that's what's going to end up making your connective tissue and your muscle. So it's made out of mesoderm. The coelom is your internal body cavity. As we were talking last semester about things like the abdominal cavity, the thoracic cavity, those are all part of your coelom. There's a lot of organisms out there that don't have a coelom, but we do, and that body cavity ends up becoming sort of the hollow spaces between the organs that are in our ventral body cavity. Foramen ovale we talked about back in the heart chapter. Remember that there is a hole in the interatrial septum between the right atrium and the left atrium. This is one of our bypasses so that the blood gets shunted away from the lungs, since the fetus is not using the lungs just yet. So remember that hole is supposed to close up right around the time of birth. Ductus arteriosus we also talked about back in I think this was in the veins chapter, the arteries and veins chapter. So remember that there is a shunt between the pulmonary trunk and the aorta. Once again, that shunt is to prevent the blood from going to the lungs. Here in this picture, they have labeled a PDA. That is patent ductus arteriosus. We talked about that condition as we were talking about it in the circulatory system. So it means that that didn't close up, and so the baby is still shunting blood away from the lungs even after birth, which is not supposed to continue to happen. A teratogen is anything that promotes abnormalities in an embryo. Teratogens tend to be carcinogens, but specifically there is a difference in those two things. So carcinogens are chemicals that promote cancer, but those same chemicals can also promote abnormalities in a fetus as the fetus is developing. One of the things that we talked about last semester was Accutane, which is a chemical that is applied topically for people who have very severe acne. it is a wildly teratogenic substance. And so people who are given Accutane, they have to sign pledges saying that they're going to practice at least 2 different forms of birth control. If it's a woman on that drug, she has to go in for routine pregnancy tests, and that's because if she gets pregnant while she's on Accutane, that baby is virtually guaranteed to be born with a birth defect because isotretinoin, which is Accutane, is a teratogen. Fetal alcohol syndrome means mom drank excessively during the pregnancy, and there are certain features that tend to be dominant in people who have fetal alcohol syndrome. So microcephaly means smaller head than normal. Because the head is smaller, that means the brain has to be smaller, so there's usually some intellectual disability that goes along with that as well. Thalidomide. This is a chemical that is still used today to treat autoimmune diseases. Over in Europe, which I'm saying all of this on the slide, but in Europe, it was given over the counter for women who were pregnant that were experiencing morning sickness. And so women didn't have to go to a doctor or anything. They could just go buy thalidomide for their morning sickness and take it. And what it ended up resulting in is a generation of children that were kind of rudely called flipper babies, and it was because their arms didn't develop correctly. Thalidomide is a teratogen. This didn't happen in the United States. It was never given as an over-the-counter med. We thankfully have rules in place that prevent medicines from just going out over the counter like that. They have to be tested and verified as safe, and thalidomide was not. For people who have autoimmune diseases, again, if they're going to be given thalidomide, we got to make sure they're not trying to have a baby and there's no risk of pregnancy, or the birth defect is much more likely to happen. What's happening during the fetal period? Primarily, all of our organs are in place. Some of them aren't very functional just yet, but they're in place, and we just have to make them bigger. And so really, we're just growing during the fetal period. Describe some of the anatomical changes that occur in the mother while she's pregnant. I'm sure at some point you've met a pregnant woman, so you've seen some of these things. Her breasts get bigger, so she's got to buy all new bras. Her hips tend to get wider, so we get those nice maternity pants, which incidentally are crazy comfortable. All of the organs that are in the abdominopelvic cavity get shoved out of position. If you've never seen a scan of a pregnant woman, it's crazy. Like, her intestines get shoved up towards her diaphragm. The baby is on top of the bladder, and so the bladder gets shoved down a little bit, and it doesn't have the room to expand like normal, which is why pregnant women have to pee all the time. So there's a lot of different changes that are happening to mom, some of which she might like, most of which are uncomfortable. Some of the other specific things that happens, when a woman is pregnant, her vagina tends to get a little bit more flush with blood, and so it can tend to turn kind of purple. Now, I know the picture says blue, but it really ends up being a little bit more purple than it does blue. So if a lady's got a purple cervix, it tends to mean that she is pregnant. Lordosis is the swayback that is associated with pregnancy. As the center of gravity moves more forward, it tends to just make the back curve a little bit more prominently than it would normally. So this is just something that happens in pregnant women or, incidentally, obese people. Relaxin is a hormone that gets produced that helps to weaken some of the cartilage that's around the pelvic girdle so that it will be able to expand ever so slightly. What that allows is more room for the baby to come out of there. So like it says in the bottom sentence, it helps to widen the birth canal so that the baby will fit through it okay. How much weight should a woman gain during pregnancy? Somewhere around 25 to 30 pounds is normal. What's important for you guys to understand is if a woman does gain more weight than that during her pregnancy, she puts herself at risk of numerous complications. The one that I'm putting up here is gestational diabetes. But it can also raise her blood pressure, which can increase her risk of preeclampsia. So it's important to not gain more than that. So a lot of women have this saying while they're pregnant, they're eating for 2. You're not really eating for 2. You're eating for like 1 1/8. You are allowed additional calories so you don't lose weight, but you shouldn't go overboard, because if you do, you're putting your health and your baby's health at risk. Also, you are supposed to gain some weight. If you don't gain weight during the pregnancy, you're going to have a low birth weight baby, and they have dramatic complications from vision problems to nervous system development, and so we don't want that to happen either. Gain just the right amount of weight. We kind of talked about folate and folic acid earlier. Early in the pregnancy, as the neural tube is developing and sealing up, folate helps it to close up, essentially. So if you don't get enough of it, it doesn't seal correctly. So that's the spina bifida complication we talked about earlier. So preeclampsia is a condition that honestly needs a lot more research. But what happens during preeclampsia is mom is going to develop severe hypertension, which is, of course, high blood pressure. That hypertension appears to have negative effects on the placenta. and it can detach from the uterus, which means now it's not getting the maternal blood supply that it's supposed to, and so the fetus can actually start to die if mom gets preeclampsia. It's also very life-threatening for mom, and so we always watch blood pressure when a woman is pregnant, and if it starts to get too high, we put her on bed rest to try to prevent this condition from progressing, because if it does, it can be fatal to both mom and the baby. We're not really sure why the hypertension develops. We're not really sure why that causes the damage to the placenta. There's a lot of stuff we still need to learn about preeclampsia, because we don't have a ton of treatment options that are safe for a baby yet, but we do know if we have it, we've got to help control that blood pressure. Parturition is the act of giving birth, and I decided I wanted to show you apparently in dogs versus in people. So this is a dog giving birth to little puppies. Aren't they cute little puppies? Well, they're not really at first, and your baby's going to be super gross at first too, but after we get them cleaned up, they're adorable. Labor is all the stuff that the mom has to do in order to complete parturition. So this is the muscle contractions, the breathing, the pushing, all of that jazz. A rise in which hormone triggers labor. It's honestly a dance between a whole bunch of different hormones, but there is a specific rise in both estrogen and progesterone around the end of the pregnancy. Once we get that rise, then the pituitary is going to start to produce oxytocin, which is going to actually strengthen the contraction so that you can push the baby out. So you need a lot of different hormones. These are just the two that I'm having you guys put in the notes. Next up, we have 3 stages of labor. This one is by far the longest stage of labor. Like if a woman's in labor for 23 hours, 22 of those hours were spent in this stage right here. So this is where the cervix is going to dilate to 10 centimeters. I think I mentioned earlier, if you hold your hand in sort of the hook'em horns with your pinky and your thumb out, that's about 10 centimeters, and so that's how far apart it's supposed to be. The woman is having contractions during this period. The contractions are getting stronger and faster during this period, but she should not be actively pushing during this period. She is basically just preparing for labor during the dilation period. Next up, we have the push the baby out stage. This really needs to happen fairly quickly. Your book says up to an hour. Most doctors want the baby to be born within 30 minutes. Once you start pushing, that baby needs to leave fast. If it doesn't, what happens is we start to choke off blood supply to both the uterus, and it also contorts the neck here, and those two things kind of put together increases the risk of cerebral palsy if the expulsion stage takes too long. And so again, needs to happen fairly quickly. This is also the stage where tearing is fairly common, and there's a procedure that happens that called an episiotomy during this stage, where they cut a woman from the vagina, usually back or at an angle, to try to prevent any tearing. Weird little thing to know about that is you'll usually tear from where they finished the cut, and so tearing of the perineal area is very common during the expulsion stage. It's one more thing to be joyous about after the birth. After you've given birth to your baby, you have to also give birth to your placenta. This is what's known as the afterbirth, because it's supposed to come after the birth of the baby. You have to make sure all of the placenta comes out. If some of it stays behind, that's going to be a breeding ground for infection, which can be life-threatening for mom. So this just needs to happen afterwards. This is usually happening as the doctor is stitching you up because of that tearing that I mentioned on the previous slide. Your baby is being given APGAR tests, and they're getting their screening tests, and they're doing vaccinations. Like you're not playing with your baby during this stage. The nurses are dealing with the baby, and you're just sitting there kind of recuperating from the fact that you just shoved a baby out of a fairly small hole. Dystocia is difficult labor, so all labor's kind of difficult. This is an excess of that labor. This can be due to the narrow birth canal, like maybe your anatomy of the hip bones was just too narrow, and so that makes labor more difficult. There can be some other complications that can lead to this as a problem too. If the dystocia is severe enough that it is slowing down the expulsion stage, we'll just go ahead and do a C-section. What I like to mention when we talk about C-sections is C-section is supposed to be an emergency procedure that happens because a woman can't otherwise give birth naturally. Also remember that stuff we talked about with like herpes. That's a baby that needs to be born through C-section as well for the health of the baby. What I'm saying up here is When a baby gets born through a normal, healthy vagina, the species of bacteria that live in mom's vagina, like lactobacillus, lactococcus, those seed into the baby, it gets into the baby's mouth, and those species of bacteria help the baby digest their food better. In fact, we put sugars in our human milk, moms do when they're making their milk in their mammary glands, that is specifically to feed that bacteria. When a baby is born through a C-section, they aren't exposed to that bacteria. Instead, they're exposed to like Staph aureus and Staph epidermidis, and those species don't help them digest the milk the same way. And so that can have metabolic complications that we're only really just starting to learn a little bit about. And so that's why you shouldn't do a C-section unless you really medically need to do a C-section. Neonatal period is the period right after you had your baby. If it's your first baby, this is a very stressful period because every burp, hiccup, cough, poo, it's all brand new to you and you freak out about it, especially the poo, because the first poos look very different from any poo you have ever seen in your life. And so you usually have the pediatrician on speed dial and you're calling them about every little thing because it's all new for you. It's all new for the baby and it's just a very stressful time. Right after the baby is born, I mentioned the APGAR test. So the nurses are testing your baby to make sure everything looks okay with the baby. These are the 5 things that they are testing, and each one of those things, as I said here, is worth 2 points. They do the APGAR test twice, once immediately after the birth, and then after a few minutes. The one right after the birth, your baby's probably not going to score very well because it takes a second for them to kind of realize, holy crap, I'm responsible for everything on my own. I guess I should start breathing now. After about 5 minutes, the APGAR test should be up within 8 to 10. If it's not, your baby might have some complications that are going to need some additional medical treatment. The initial breathing stimulus is the same as the breathing stimulus for you to either increase or decrease your breathing, and that is carbon dioxide levels. So remember, hypercapnia means elevated carbon dioxide levels. So after they haven't been exchanging materials with the placenta for a bit, their CO2 levels are going to build up, and that's going to trigger their breathing. I've actually got a little video to show you guys about this one. Just kind of watch how long it takes for this baby to breathe.
Okay, I'm going to put this up. Go ahead.
Go ahead.
Oh, is this a video?
Yeah, I'm recording now.
There we go. We have now realized we are alive and we have to do everything for ourselves, so it takes some time. Notice they're also still in the process of cleaning all the goopy stuff off your baby. There's a bunch of mucus and amniotic fluid and dead cells, and so again, your kid's going to look fairly gross immediately after birth, but you know, they'll chill out a little bit after we get them cleaned up. Lactation is the act of making milk. We talked about these hormones a little bit earlier, but you do need prolactin to help you actually make the milk, and then oxytocin helps you to release said milk. Of course, we also need estrogen to help us with breast development as well, but these are the 2 that are primarily responsible for lactation as a whole. The first milk that you make isn't actually like real milk. It's colostrum, which is a filtrate of the plasma. Colostrum does have a bunch of antibodies in it, and so that's mom's way of still trying to protect the baby by giving her some of her antibodies so that she's protected from certain infections. I mentioned the first poo a baby has doesn't look anything like normal poo. That first poo is called meconium, and it's usually described as tar-like. You can see it in this picture right here. It's a collection of a bunch of dead cells and mucus from the digestive system, and that's because they haven't eaten anything, and so this is just sloughing of the lining, and it's fairly gross looking, but it's normal. This is what that first poo is supposed to look like. Some of the reasons breast milk is best. There's a lot of propaganda out there about why you should breastfeed your child. There are also reasons why some parents have to choose formula for their child. So I'm giving you the true medical reasons why breast milk is best. There's evidence to support everything that I am saying up here in this slide. There are other reasons that there's not as strong evidence for, and so just kind of look at those things with a grain of salt. So it's really fairly self-explanatory, but I also did mention human breast milk has specific oligosaccharides in it to feed the normal flora, those bacteria, Lactococcus lactobacillus, that has been seeded in there. So breast milk does also help with the development of the normal flora in the intestines. I didn't put that on the slides yet, but again, there's more evidence coming out about that too. These are some of the other reasons that some people have linked to breast milk being best for. But again, there are some babies where breast milk is not best. For example, we talked about PKU in a previous chapter. Breast milk is not best for a child with PKU. In fact, it will lead to mental deterioration. And so there are specific instances where formula is actually best. Specific formula in the case of PKU. After that, we're going to talk about infertility and then birth control options. So infertility is the inability to have a child or conceive after 1 full year of having unprotected sex. That 1 full year is actually important. That means you didn't just try once or twice and you couldn't. Maybe you just didn't time it right during that couple of times. And so you have to have tried for a full year before a doctor is really going to start talking about infertility with you. Some of the more common causes that they tend to look at first is maybe the guy has a lower sperm count. Well, we can fix that by collecting what I'm going to call multiple ejaculatory events and then essentially turkey bastering that so that we can increase the amount of sperm that enter the vagina at one time. So insemination might be able to help in that case. If there's a large proportion of abnormal sperm, but the man does still make functional sperm, just not at the numbers really that he's supposed to have, we can collect some of his good functional sperm and then do something called intracytoplasmic sperm injection, where we inject 1 healthy sperm into an egg for fertilization, and then we can do in vitro to help implant that later on. So there's options to fix both of those conditions. In females, being significantly underweight can prevent ovulation. Being overweight can block the oviducts. The fat will actually compress them so the eggs don't make it to the uterus, and so losing weight can help with that condition. Some women have a hostile uterus, and so surrogacy might be an option for her. But there are options to help infertile couples up to and including adoption. So hitting some of those things for treatment options. Artificial insemination. So again, you can collect multiple events from the biological dad, or you can get a donor who has healthy sperm and then do artificial insemination that way. Either of those is an option. IVF is the most common way to treat infertility. What we do is we mix sperm together with eggs outside of both parents. We allow them to develop into the blastula stage, and then we can test the blastula to see whether they have any genetic abnormalities. We can test to see if they're male or female. Technically, we can test for other things, but the ethics start to get really weird at that point. But after we have verified the health of those embryos, we can implant those into mom. It is legal to implant up to 5 embryos at one time, and that's because in vitro fertilization is fairly expensive. The chance of it being successful is fairly low, and so by implanting 5 at one time, you're increasing your chances that you might get pregnant. However, you're also increasing your chances that you might have multiple births, and so that's why you will see a lot of parents who tried IVF that have like quadruplets or triplets. It's because sometimes almost all of the embryos take when they implant 5. Gamete intrafallopian transfer just puts the stuff back together. You can read the definition that's up there. It's all happy. Surrogacy is you pay for a woman's medical care while she is pregnant with your baby. In the state of Texas, it's illegal to pay her to just give birth to your kid, essentially, but you can pay for her medical care and make sure that she has a good diet and all that sort of stuff. This one's actually more common in our area than I would have thought that it would be, but you just have somebody else conceive your child and maintain the pregnancy for you. This one I mentioned, if dad's still making some good sperm, but a lot of his sperm is bad, you can inject 1 good sperm into an egg. I'm not going to talk about that. We just don't have time to really debate that. So next up, we're going to start talking about control of reproduction. The effectiveness stuff is off down here at the side, and what I want to show you is there's a bunch of things that aren't super duper effective. First one that we're going to talk about is coitus interruptus. Essentially, it's I'll pull out, baby, I promise. Notice it's not super effective. At least I don't consider a 25% chance of getting pregnant super effective, so that's my personal opinion on that. Pardon me. It doesn't prevent against STDs. It also, there is to use a crude term, there's precum. In precum, there is sperm present. While the numbers aren't high, there can be enough sperm in there to actually impregnate a woman, and so coitus interruptus is not a very good method for preventing pregnancy. So, yeah, there. I also do want to mention, I'm not going to talk about abstinence because that's the only thing they really teach you very well here in high school. So I know y'all know what abstinence is. It is the only 100% effective way of preventing both pregnancy and STIs. But I'm going to give you the other ways where you can still have some fun but not get pregnant. All right, rhythm method. So this can be as simple as you count days on a calendar for a woman who has a fairly regular period, and then you don't have sex around the time you know she's ovulating, which is about 2 weeks after her period. If you're only counting days on a calendar, this is only about 60% effective. If you couple this with ovulation test kits, temperature checks, and cervical mucus checks, it can get to be up to 90% effective. And so the effectiveness varies depending on how well you're actually doing the rhythm method. I'm not a Catholic, but I know that back in the 70s, the Catholics would actually give you this little disc that helped you do this as a birth control method, and that's because the Catholic Church, at least at the time, I don't know what their rules are now, but back then, you were not allowed to do any other form of birth control aside from the rhythm method. Let's see. Diaphragm is what you have next. This is a diaphragm off down here. It's a little latex cup. The woman has to insert it up her vagina and then over the opening of the cervix prior to having sex. We usually couple that with a spermicidal jelly, like we'll put a little rim of it around the rim of the diaphragm. That way any sperm trying to sneak around it get killed by the spermicidal jelly. You do have to be fitted for this by your doctor, but once you get it, as long as you don't gain or lose a lot of weight, it's good to go for quite a while. Most of them are dishwasher safe, if you wanted to know that. It's important that you make sure that they are staying nice and clean. They can actually seed infections. And so just make sure you are washing them in between use. And if you do gain or lose a lot of weight, you have to go and get resized. Condoms are what you guys have next. If used appropriately, these are up to 95% effective. If they're used inappropriately, things can start to happen. And for that, I'm going to give you a story. The story was told to me by a legal clerk in Tarrant County, so not Johnson County. There was a case where two couples were going to prom together, and after prom and after their drinking, they decided they were going to have sex, but learned, oh crap, we only have one condom between us. And so what they did was one couple had sex with the condom, then grossly they turned it inside out and gave it to the second couple, and then they had sex with that same condom. And of course, the second couple female ended up getting pregnant, and it turned into a law case to find out whether her boyfriend or the first boyfriend who had turned the condom inside out was the father of the child, and it turned into this whole thing. So I never thought I would need to say this, but apparently I do. Condoms are not reusable. You use them once, you throw them away. Also, make sure you apply them correctly. They're supposed to be a reservoir tip so that the sperm can actually fill that instead of trying to squeeze out the top sides. And then make sure you take it off appropriately. It should not come off inside the woman. Make sure you are wearing the correct size for you. There's a bunch of disclaimers, but if you don't follow all those rules, they don't work as well. I will also mention there are female condoms. I've never found any for sale in stores in our area, but you can find them online. IUDs and IUCs. So an IUD is an intrauterine device. It usually has copper in it. That copper causes inflammation to the uterus. That inflammation prevents implantation so that you don't get pregnant. You are still ovulating every month. You just can't actually implant the uterus. An IUC, on the other hand, is an intrauterine contraceptive. This one, it does also cause some of that inflammation earlier, but it also releases hormones. And those hormones, just like with the pill that we're going to talk about next, shuts down the pituitary gland from releasing FSH and LH. As a result, you don't ovulate. And if you don't ovulate, you can't get pregnant. So birth control pills, they are oral contraceptives. So yes, you are supposed to take them orally, not insert them into your vagina. It is the female's responsibility to take this pill at the exact same time every single day, never missing a dose. If she gets put on any other meds, it's important that she talk to her doctor about whether or not those meds might reduce the efficacy of her birth control pill, because especially some antibiotics reduce the effectiveness of the birth control pill. If you miss a dose, you are more likely to get pregnant. So if you do miss a dose or you end up having to take some antibiotics that can influence them, you have to use a second form of birth control as well. Birth control pills do have a number of very serious side effects, including they increase the risk that a woman suffers from a stroke or heart attack because they make clotting more likely to happen. There are lower dose birth control pills. Those reduce some of that risk, but that risk is still present. I also showed you a video in a previous chapter, I believe. Birth control pills are also used to treat a number of different problems like endometriosis or polycystic ovarian syndrome or PCOS. And so if a woman is taking those for those diseases, it's still birth control. It's still going to prevent her from having a baby as well. There are a bunch of different kinds of oral birth control. Some of them, they reduce the number of periods that a woman has. So maybe she'll only have like 3 periods a year or 4 periods a year. So there's a bunch of different kinds. If one doesn't work for you, talk to your gynecologist about trying a different brand, because there's probably one out there that works better for you than the one that you had currently been on. This one's not in the notes, but I wanted to give you. It's something that students in our area have used. The brand name for this used to be Norplant. I don't know if there's a different one at this point, but it's a little plastic stick that has the hormone impregnated in it. They surgically put this usually into the upper arm, and then it releases hormones for years, and then you take it out after 3 years, and you can put more in if you want to. And so that's an option that you don't have to think about taking a pill every day. That does all the work for you. There are patches. The risk of side effects is slightly higher with the patches, but you don't have to like do it every day. You put it on, you leave a patch on for a week, and then you switch it out for another patch at the end of that. I haven't really talked to anybody that's used the patch, but if you think you want a patch instead of a pill, there you go. This one used to be really popular with my friends back when I was younger. Depo-Provera is a shot that you go get about once a month, but it does vary depending on you and your relationship to Depo. One of the benefits that it was the reason that we liked to take it back in the day was it can actually prevent you from having periods. And I've never met a woman who likes to have a period, so there you go. That can prevent that and prevent the pregnancy as well. I won't talk about that one. Next thing you have in your notes is morning after pills. So there's a couple of different forms of those. Previn is a brand name. There's also one that's called Plan B, and it's called Plan B for a reason. It's because you had a Plan A and Plan A failed. Like you used a condom, but oh crap, it broke. Or you were using birth control and then you realized, crap, I forgot to take it yesterday. And so what you would do after a sexual encounter when Plan A failed is you would go get Plan B and take Plan B, and it prevents the embryo from implanting. It's important to know that it does not prevent you. If you've already got a baby in your uterus, it will not get rid of that baby in your uterus. And so those won't terminate a pregnancy, they just prevent a pregnancy from happening. RU486 is different. It's just called the abortion pill, and it is exactly that. You take the pill and then you go home, and essentially you have a miscarriage at home. That's how that particular one works. And so that does the abortion, which is also one of your related clinical terms. That completes the notes for this one. There's going to be a quiz posted, the Chapter 28 assignment. You guys can either upload that or just email me your answers to that so that I can give you that last quiz grade. Remember, it can help you drop a lower grade.